Tell you that the Ministry of Health has tonight confirmed the presence of the Indian double mutant variant in the country following a gene sequencing report released last week from 5 persons who tested positive for COVID-19. A similar report is also being awaited from the Khemri Wellcome Trust in Kilifi from samples of 18 persons who landed in the country from India and who also tested positive for the virus. Let's get more from our very own Raquel Muigai.
As Kenyans continue soaking up in the newfound level of freedom that comes with the easing up of restrictions by President Uhuru Kenyatta just 4 days ago, so is another unexpected but inevitable visitor unfortunately settling in.
Regarding the mutant, the double mutant or the Indian variant, yes, this variant has been picked in Kenya. And because of global connectivity, it is just a question of time.
This was picked up from 5 Indian travelers in the western part of Kisumu, who, according to the Ministry of Health, the 5 were conducting some work at a fertilizer plant in Kibos.
We have gone ahead, together with the Kisumu County Health team, to do contact tracing and essentially ring-fence that area, especially for local transmission from these initial primary contacts.
With the ministry yet to receive the details of the follow-up gene sequencing being done in Khemri, Kisumu, so is a similar report being awaited from samples of 18 individuals who tested positive for the virus just after landing from India last week.
With respect to those who turned positive, the protocols and procedures are that they are isolated, quarantined for the required period of time.
The double mutant variant of the coronavirus, which acquires its name from having 2 mutations combined in one, is believed to be a key contributor for the now horrific second wave of the disease in India. According to genome sequencing reports, scientists state that one of the mutations can change the shape of the spike protein, which is what the virus uses to make contact with human cells to create an immune response that leads to antibodies. If that is the case, then antibodies may not be able to recognize and neutralize the virus effectively, even in those who have been vaccinated.
And our call to the counties is that the Lord has been merciful. We have this respite period when the numbers are going down. Let's use this opportunity to be able to strengthen our capacity in preparation for a potential wave that will come thereafter.
Here in Kenya, the UK variant was the source of the spike in the number of COVID-19 infections and ultimately the 3rd wave of the disease. Just like other countries, the Ministry of Health is pegging its hope on COVID-19 vaccination, whose plans still remain blurred. Only 945,900 persons have been vaccinated so far.
Hoping that the situation in India stabilizes, then we are looking at the end of May to when we shall get the second consignment of our vaccines.
7 billion shillings has also been set aside by Treasury for the next financial year for acquiring Pfizer and Johnson & Johnson vaccines. With the confirmation of the presence of the Indian double mutant here in the country, the uncertainty of when exactly Kenya will receive another shipment of the COVID-19 AstraZeneca vaccine still remains. The Ministry of Health asking Kenyans to remain vigilant to avoid an increase in the number of infections given the eased restrictions. Raquel Muigai, Citizen TV, Nairobi.